This is part 2 of the concept map video. So, as I was saying before, a risk factor of acquiring heart failure is obesity. People that are obese have a greater risk of acquiring hypertension. And hypertension can lead to left ventricular systolic dysfunction, which is caused by left ventricular failure. Left ventricular failure leads to an increase in hydrostatic pressure in the pulmonary veins, which leads to fluid leaking into the pulmonary interstitial space, which leads to pulmonary edema. And so left ventricular failure is similar to right ventricular failure because right ventricular failure also leads to edema. But this is specific. This is pulmonary edema. So, and also orthopnea, which I mentioned before, it means shortness of breath when lying down. This can also lead to fluid leaking into the pulmonary interstitial space, which leads to pulmonary edema. Next, hypertension can lead to an increase in resistance against the left ventricle, which leads to hypertrophy of the left ventricle. This is when the left ventricle becomes enlarged, which leads to a decrease in cardiac output and a decrease in stroke volume. So, hypertension is related, left ventricular failure is related to the etiology of heart failure, which is coronary artery disease, because both cause the heart to become enlarged. So coronary artery disease causes cardiomegaly, which is an enlarged heart. Left ventricular failure leads to left ventricular failure leads to left ventricular systolic dysfunction, which is caused by hypertension. And hypertension can lead to hypertrophy of the left ventricle. Next, I mentioned before that a risk factor of heart failure are kidney problems, such as lupus nephritis. So when you have kidney problems, there is an increase in nitrogenous waste in your body that your kidneys have a hard time getting rid of. This increase in nitrogenous waste is poisonous to your heart muscle. This causes a weakened heart muscle, which leads to ventricular failure, also known as heart failure. Also, I mentioned before that an etiology of heart failure are heart attacks or myocardial infarctions. So, myocardial infarctions are caused by an increased risk. If you have an increased risk of arteriosclerosis, you have an increased risk of having a heart attack. Arteriosclerosis is a buildup of fat in your arteries. Okay, so next I am going to explain a complication of heart failure. Actually, I'm going to continue with risk factors, actually. So another risk factor of heart failure is smoking. And this leads to an increased risk of arteriosclerosis. Smoking also is linked to an etiology of heart failure, which is COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease leads to constriction of pulmonary arterial vessels in your lungs, which leads to pulmonary hypertension. And pulmonary hypertension leads to an overworked right ventricle, which leads to left ventricular failure, which is also known as heart failure. Also, pulmonary hypertension is Okay, so is linked to another risk factor. Okay, so another risk factor of heart failure is sleep apnea. It is a sleep disorder where breathing repeatedly stops and starts. So this is linked. This causes hypoxia, which is a low amount of oxygen in your body, which causes, which leads to the narrowing of the pulmonary artery, which leads to pulmonary hypertension. So sleep apnea, which is a risk factor of heart failure, is linked to the etiology of heart failure, which is COPD. Next, another risk factor is are viruses. So viruses cause myocarditis. Myocarditis is inflammation of the heart muscle. This leads to a weak heart muscle, which leads to a decrease in cardiac output and stroke volume. Next, I am going to explain the complications of heart failure. One of the complications is thromboembolism, which is an obstruction of the blood vessel due to a blood clot. And this can lead to thromboembolisms can lead to myocardial infarctions because the blood clot can break off from being attached. Originally it's attached to the wall of the blood vessel, inside the blood vessel, and then it can become detached and go into one of the coronary arteries of the heart and cause a heart attack. And so a complication of heart failure is linked to the etiology of heart failure, which is a myocardial infarction, and then which leads to cardiogenic shock, which is when the heart can't pump enough blood. This leads to a decrease in blood pressure, which leads to organ failure, and a decrease in blood pressure causes the stimulation of the renin-angiotensin-aldosterone system to increase blood pressure. So next, there is the last point that I want to make is another complication of heart failure, which is arrhythmias. So arrhythmias are irregular heartbeats. This can lead to cardiac arrest, which can lead to death. And also, arrhythmias can lead to weak ventricular contractions, which are caused by myocardial infarctions. So, arrhythmias are linked to myocardial infarctions. A complication of heart failure, which are arrhythmias, are related to the etiology of heart failure, which is myocardial infarction. And that is the end of my presentation. Thank you so much for listening. Bye.